Good evening. Tonight we're diving into the world of medical reports and their significance. On April 11th, 2025, Donald J. Trump underwent his annual physical examination at Walter Reed National Military Medical Center. Conducted by White House physician Captain Sean P. Barbabella, DO, in consultation with 14 specialty consultants, the results were released on April 13th, 2025. The report describes Trump as being in excellent health and fully fit to execute his duties. Presidential health isn't just about one man's cholesterol. It's about the ability to handle immense pressures. The leader shoulders significant responsibility. From making critical decisions to representing the country globally, health is crucial. The job stress is unimaginable, affecting both mind and body. Imagine handling global crises, economic issues, and social media controversies daily. The ability to manage these is vital for stability. Knowing the president is physically and mentally fit is essential. It's not just curiosity, it's about ensuring they can handle the job's demands. The president's health influences decisions affecting millions. The release of a presidential medical report, once routine, is now a topic of significant interest. It's scrutinized and analyzed for insights. Remember when we trusted our leaders to be fit for office? Those days are gone, replaced by demands for transparency and accountability. Skepticism is rampant, and for good reason. Leaders have hidden health issues, leading to mistrust. We've been burned before, and the ashes of mistrust linger. It's a reminder of the need for transparency and leadership. So buckle up, because we're about to dissect Trump's medical report with precision and a bit of scrutiny. We'll examine every detail and what it means for the future. Get ready for a deep dive into cholesterol counts, cognitive tests, and medical data. It's an eye-opening journey into the health of a president and its implications for us all. Let's start with the vital statistics. At 78 years and 10 months old, Trump stands 75 inches tall and weighs 224 pounds, down from 244 pounds in 2020. His BMI is approximately 29.7. His resting heart rate is 62 beats per minute. Blood pressure is 128/74 mmHg, which is considered elevated but within normal range for his age. Pulse oximetry is 99% on room air, and his temperature is a steady 98.6 degrees Fahrenheit. All are normal. His eyes show normal visual acuity, visual fields, and eye pressure. A dilated eye exam was normal. Head, ears, nose, and throat exams revealed no significant abnormalities, except for scarring on the right ear from a gunshot wound sustained during a July 2024 assassination attempt in Butler, Pennsylvania. Hearing was normal. The neck exam showed normal thyroid and lymph nodes. A July 2024 carotid artery ultrasound showed normal results. Pulmonary examination revealed clear lungs, and a chest CT scan showed no abnormalities. Cardiac examination showed normal heart rhythm and sounds. Electrocardiogram, EKG, and echocardiogram showed no abnormalities, with a healthy ejection fraction and unimpaired blood flow to extremities. Comprehensive neurological exam revealed no abnormalities in mental status, cranial nerves, motor sensory function, reflexes, gait, or balance. Trump scored 30/30ths on the Montreal Cognitive Assessment, MoCA, indicating normal cognitive function. He also completed the Patient Health Questionnaire 9, PHQ-9, and Generalized Anxiety Disorder 7, GAD-7, for depression and anxiety screening, with normal scores. Dermatologic, minor sun damage and benign lesions, no concerning growths. Musculoskeletal examination showed full range of motion in joints and muscles, with normal blood flow and no swelling. Urinalysis results were normal. Now let's delve into Trump's medical and surgical history. He has well-controlled hypercholesterolemia, seasonal allergies, and a history of COVID-19 infection in October 2020, which required hospitalization. He also manages rosacea, a skin condition causing facial redness, and has actinic keratosis, which are precancerous skin lesions from sun exposure. In July 2024, a colonoscopy identified diverticulosis and a benign polyp, with a follow-up recommended in 2027. His surgical history includes an appendectomy at age 11 and bilateral cataract surgery, though the date for the latter is not specified. His current medications include rosuvastatin, Crestor, and ezetimibe Zetia for cholesterol control, aspirin for cardiac prevention, and mometasone cream as needed for rosacea. The report addressed public speculation about cognitive decline, noting no abnormalities in neurological or psychological assessments. Critics, including some medical professionals, argue the MOSIA is a basic screening tool and not sufficient to rule out complex cognitive issues, especially given Trump's age and family history of dementia. Posts on X reflect polarized sentiment. Supporters like at Gunther Eagleman praised the results, while skeptics like at Art Candy questioned their credibility. Let's get down to the nitty-gritty. We're diving into the medical report that has everyone talking. What did this long-awaited medical report reveal about the former president's physical state? Let's break it down. First up, the vital stats. Trump, standing at 6 feet 3 inches, weighed in at 285 pounds. Even I can tell you that's venturing into unhealthy territory. It's like he's been living on a diet of fast food. Cholesterol levels? They're higher than recommended, which can lead to complications like heart disease and strokes. The physical exam itself was routine, but with a few noteworthy points. No major red flags, except for a slightly enlarged prostate, which is common for a man his age. Overall, the report paints a picture of a man who's clearly not a stranger to fast food, but he's still managing. His lifestyle choices are catching up with him. But before you draw any conclusions, remember this: medical reports are rarely what they seem. There's always more beneath the surface. There's a lot more to unpack here, folks, so stay tuned. We'll be diving deeper into the details and what they mean for the former president's future. Don't go anywhere. Let's take a trip down memory lane, delving into his medical history. Trump's relationship with healthcare has been complicated. Ironically, he's benefited from the system he critiques. Remember when he bragged about acing a cognitive test? It's a test for early signs of dementia, not something to brag about. His surgical history has been uneventful, a few minor procedures, nothing dramatic. Who needs major surgery with doctors on speed dial and a golf course at your call? Speaking of golf, more on that later. Trump's health has been scrutinized since he entered politics. The man's older than the avocado shortage and twice as unpredictable. Section 4, the Trump Medicine Cabinet, a peek inside. Now for the moment you've all been waiting for, a glimpse into the medicine cabinet of the former president. We're diving deep into the daily regimen of Donald J. Trump. Trump's daily medications include a statin for his cholesterol, which is quite common for someone his age and lifestyle, a low-dose aspirin to prevent heart attacks, a staple in many medicine cabinets across the country, and Propecia, a medication often prescribed for hair loss. In the official medical report released by the White House on April 13, 2025, there is no mention of Propecia, finasteride, a medication commonly prescribed for male pattern hair loss. The report lists Trump's current medications as rosuvastatin and ezetimibe for cholesterol management, aspirin for cardiac health, and mometasone cream for a skin condition. However, in a previous medical report from 2018, it was disclosed that President Trump was taking Propecia to prevent hair loss. Additionally, his former personal physician, Dr. Harold Bornstein, confirmed in a 2017 interview that Trump was prescribed Propecia for hair loss. Trump's life on the go. Let's talk lifestyle. Trump's lifestyle includes a high intake of Diet Coke and frequent use of social media. His physical activity involves playing golf. His exercise routine centers around golfing. His sleep schedule is irregular, often involving late nights. Section 6, Lifestyle and Social History. Let's delve into President Trump's personal habits and social behavior. Trump has maintained lifelong abstinence from tobacco and alcohol, a decision that has significantly impacted his overall health. His active lifestyle is well documented. The report highlights Trump's participation in multiple meetings, public appearances, and press availabilities, along with his frequent victories in golf events. While some critics argue that mentioning golf is irrelevant to a medical assessment and suggests possible editorial influence, it's clear these activities contribute to his well-being. In terms of immunizations, Trump has received all recommended vaccinations, including those necessary for travel. This ensures he remains protected against various diseases, reflecting a proactive approach to health management. This look into his lifestyle and social history provides insights into the habits and activities that shape his daily life. Stay tuned as we explore more aspects of Trump's health and well-being in the next section. In Scene 7, we delve into President Trump's April 2025 medical report, which provides an updated view of his health. The report portrays him as physically and cognitively fit for office, with notable improvements in weight and cholesterol levels since 2020. These improvements reflect a commitment to maintaining his health amidst the presidency's demands. The report also highlights minor conditions such as diverticulosis and rosacea. These are common and manageable, posing no significant threat to his overall health. Furthermore, the report acknowledges scarring from the 2024 assassination attempt, a somber reminder of the dangers faced in public service. Despite these minor conditions, no major health concerns are reported, reinforcing the image of a president who remains robust and capable. This comprehensive assessment underscores the importance of regular medical evaluations in ensuring the well-being of our leaders. Stay with us as we uncover more aspects of President Trump's health journey and the factors contributing to his resilience.